Thank you for taking the time to respond to your constituents' request to watch this brief video. Your public service is sincerely appreciated, and it's definitely something that you have in common with public healthers across Iowa. We, like you, are proud of our state, love our communities, and want to see a bright and healthy future for our children and grandchildren. The Iowa Public Health Association's 2021 legislative agenda has three main components. First, we'd like to see increased funding for local public health agencies so that they can increase the capacity they have to do the work to improve community health. We'd also like to see an assessment of the whole public health system to realign purpose, mission, and to maximize capacity of all the major players in our state. And this includes the College of Public Health at the universities, the Iowa Department of Public Health, the State Hygienic Lab, and of course the local boards of health and local public health agencies, including those that are embedded in hospitals. We need to understand what we currently have against the national standards for operating successfully in the 21st century. Finally, we will support any policy idea that promotes health, reduces health inequities, and protects groups that have been socially and/or economically marginalized. So diving deeper on these agenda items, we'd like to see an increase of $5.3 million in state appropriations that flow directly to local public health agencies. They've seen a gradual chipping away since FY 2007, starting with the Great Recession, but their responsibilities haven't declined. This amount would restore them back to those levels, plus add consideration for inflation. The role of local public health is critical, as we now see from the pandemic. But COVID has also shown us that we don't have the capacity that we really need to be successful locally. Beyond the pandemic lies their normal responsibilities too. And right now, they're gearing up for one of the most important ones they have, the new round of community health needs assessments and health improvement plans, called the China HIPs. If you're unfamiliar, every 5 years, local public health agencies conduct their community health needs assessments. The information they provide helps inform the Healthy Iowans Plan. A side note here that the hospitals are also required to conduct their own community health needs assessments called CHAs. Depending on the community, the China HIPs and the CHAs overlap. How confusing, I know, but we're most familiar with the work that public health does, and so that's what we reference. Right now, local administrators are actively surveying individual members of their community, local organizations and nonprofits, sister agencies in government like law enforcement, and other sectors like business and healthcare. Their plans are due to the Iowa Department of Public Health in early 2022. What they produce is intended to be a reflection of the eminent health issues of their community. They will then be expected to use the plans to guide their work locally. For some county health agencies, surveying the community and compiling progress reports are all that's ever done. There are many reasons for this, and it's not a blame game, but it's disappointing because it's a missed opportunities for their residents. For other agencies, their China HIP becomes a rally point to get different influencers in the community involved in solving the issues that are creating vulnerable populations, decreasing the productivity of their workforce, and therefore decreasing the attractiveness of their counties. People don't want to live in unhealthy areas, and businesses won't move to communities with an unhealthy workforce. Now, the disparity in the use of China HIPs as a community health beacon is one of many issues that Iowa's public health system has. We don't think it's fair to say that the system is broken. There's way too much good work being done. But what we really need is an assessment. 20 years into this century, it's hard to say that we can meet all of its demands. Interim Director Kelly Garcia is already looking at program alignment between IDPH and DHS. We want her to go further and look at the system as a whole. All things in public health start with assessment when possible. And an assessment would ask the questions, do we have the manpower, the expertise, the leadership, the skills, the data systems and data collection processes, and most importantly, the relationships to achieve better health outcomes for all Iowans. Now, some of you may be wondering, why public health? The public health purpose is unique. No other sector has the mission and vision to improve the health of all lives. That's what population health means to us, the whole population. Hospitals are concerned about patients, businesses are concerned about their customers and stockholders, insurance companies, both private and public, care about their enrollees, and so on. Public health takes the sum of all of those lives and wants all of them to have the same opportunities to be healthy and prosperous. This is a unique purpose. Forward thinking public health leaders are convening across all sectors to help all lives all over the country and even in pockets of Iowa. In these best practice scenarios, public health plays several key and critical roles. Public health diagnoses, cooperates, and prevents. Public health experts diagnose the health of each community by listening to people who live there, and then they use data, evidence, and research to offer their solutions. That's what's happening with the China HIPs right now. To improve the health of the community, different organizations have to work together: schools, businesses, government agencies, and more. Public health brings them together to make decisions and take action. Right now, we need to do more of this in every county in Iowa. We often end up in the doctor's office after we're sick or injured. Public health experts investigate everything that affects our health: food, water, air, and more, to prevent health problems before they start. And we absolutely need to do more of this. We spend way too much money on the healthcare system right now, and Iowans are not getting healthier. Public health is the missing link needed to take on the questions that will inevitably come up during the China HIP process. As mentioned before, leadership is happening in pockets in Iowa, but even the best leaders can only do so much without a system to support them. Iowans are being shorted, and the consequences are severe, like a reduction of years lived, which is also an increase in the number of years lived without a family member at Christmas. And that grief heavily impacts people whether they say it out loud or not. Another consequence is a reduction in the quality of the years we live, which is also an increase in the number of years lived with the costly and emotional burden of disease or injury. All over Iowa, it's common to see significant differences in the range of expected years of life from one census tract to the next. The data shown here comes from the Robert Wood Johnson Foundation's interactive map on life expectancy. Depending on which community you live in, you could be outlived by members of another community, even though you live in the same county or even the same city, by 5, 10, or even 20 years in some cases. We're talking about disparity in life expectancy in places that are only 20, 30, and 45 minutes away from each other. This map looks at the top 5 and bottom 5 of our state's county health outcomes according to the Robert Wood Johnson Foundation's county rankings. All of Iowa's 99 counties are ranked from healthiest to least as compared to each other. Even in the top rated counties, there's a difference of over 10 years or close to it. Bremer County, for example, has a gap of 13 years. In Wapello, one of the least healthy counties, it's a difference of 14 years. In the end, we're all Iowans, and this is not fair. Not because life is supposed to be fair, public healthers are not naive, but because we have the tools to change it and they're not being distributed in a way that maximizes impact, and that's not fair. Collectively, we're all doing worse in regards to our health. Two credible rankings are showing the same downward decline in the health of Iowa's citizens. Now, it's not all doom and gloom. There are some things we do well and some things we aren't doing well. We haven't plummeted to the bottom half of the 50 states in the union yet. For example, we don't have as many premature babies as other states, and we've slowly decreased our adult smoking rates. The work on the mental health system is showing up as a positive shift. These are positive things. But we have a high rate of obesity, a high rate of excessive drinking, and again, a lot of disparity relating to health outcomes all around the state, and this is not good. As we know, these health outcomes are connected to social determinants of health and oftentimes whether or not people have equitable access to opportunities to be healthy. We can do better for ourselves. We're Iowans. We can bring ourselves back up to where we've been before. You can see that in the 90s and the early 2000s, we were hanging around the top 10. But no one branch of government can do it alone. No one sector can do it alone. And no individual can do it alone. But public health is a problem-solving methodology, and it's got to play a bigger role than it's playing now in our state. And we can make smart improvements by first assessing where we are so that we can find a path toward improvement. Finally, IPHA will support policy ideas that promote health, reduce health inequities, and protect groups that have been socially and/or economically marginalized. Examples include health promotion, like funding the Healthiest State Initiative's Double Up Food Bucks program, or the Iowa Department of Public Health's 5210 program. Each of these work to decrease Iowa's obesity problem. Access to family planning, health screenings, and other clinical prevention tools are also another example of health promotion. We also need to improve and modernize Iowa's data collection systems, protecting a healthy workforce, reducing tobacco and vaping use, increasing immunization rates over the life course. Legislative health impact statements are something we would encourage legislators to begin using so they understand the health impact of the laws that they pass. Increasing access to oral health, supporting evidence-based COVID-19 response efforts and all infectious disease response efforts. Reducing substance use and increasing treatment. For example, removing the ban on syringe service programs is a policy that IPHA would support. And increasing the public health workforce, which includes other professions outside of registered nurses, like data analysts, communications and education staff, and community health coordinators. In a nutshell, we'll support nearly anything that positively addresses the social determinants of health. Social determinants of health are conditions in the place where people live, learn, work, play, and worship that affect a wide range of health risks and outcomes. IPHA will also support and work to protect policies that remain true to public health origins, like preserving community fluoridation, maintaining the status quo on the ban of raw milk, and increasing immunization rates. These are the American traditions of health protection that have been passed down from generation to generation. In the 20th century, they contributed to an increase in the American lifespan by 25 years and continue to be critical to population health. Thank you for listening to this message. And again, you're sincerely appreciated for your service to Iowans. This was recorded by Deborah Thompson, co-chair of the IPHA Advocacy Committee. For more information about this legislative agenda, the Iowa Public Health Association, or general public health questions, please contact Lena Tucker Reinders at lena@iowapha.org. Lena is the executive director of the Iowa Public Health Association. You can also ask the public healther who sent you this message. We're a small community, and if one person doesn't know the answer, we know someone who does.